Good morning. Thanks for being here with us this afternoon. My name is Michelle Treasure. I am the Homelessness Services Coordinator here at the City of Sioux Falls. I've been fortunate enough to have been in my role here just over a year, have learned a lot, to say the least, and I'm just really passionate about using some of that valuable knowledge with some of the services and resources and kind of the boots on the ground work, but also looking at the broader picture of what collaboration looks like, what our systems are doing, and how we're all working together. We first showed this graphic back in February at the Regional Homelessness Forum, just to share how we all play a part in helping those experiencing homelessness. This model is still a foundational asset to not only myself, but I think it's also a really great reminder to other agencies that need reminders too of what success looks like. Not only do I work with various teams here at the city, like our police department, the library, our city attorney's office, parks department, and finance, but I also get the opportunity to work with many organizations outside of the city that fall under those buckets. This work is not able to be done in silos. The needs are very complex. The people that are being supported are some of the hardest individuals to house, to help, and this requires multiple different partner agencies, skill sets, and areas of expertise. Almost every success story that I can think of during my time here at the city has involved some type of collaboration, and I smile because it brings me joy to be able to think back at some of those successes. Sometimes they're not always huge successes, but those small wins bring us all joy when we're helping and assisting this population, such as reuniting someone with family to their hometown, working alongside our state agency partners to really look at what the best treatment and recovery option is for someone that is ready for that, finding special funding for rent and deposit, and then some of the other changes that we've been making, not only to assist some of our unhoused and homeless individuals, but just our general community as well. We are using this opportunity this morning to share more about one of our partnerships with South Dakota Urban Indian Health. In March, after a thorough request for proposal process, the City Council approved a contract for the city to continue partnering with South Dakota Urban Indian Health to provide some of those street outreach services to those experiencing homelessness. We have seen great results with this approach of being more proactive to connect with individuals, meeting them where they're at, assist them with their basic needs like housing, food, clothes, water, treatment plans, and simply just taking a minute to ask someone, what is your plan for today? So with that, I would like to invite Monica Bailey, the WOKA project manager, to the podium to talk a little bit about more of their important work and what they're doing in our community.
Thank you, Michelle. So welcome, my name is Monica Bailey. I'm the program manager of the WOKA project, which is a program of South Dakota Urban Indian Health. So Urban Indian Health is a 501c3 nonprofit that serves everyone. So we're a federally qualified health center and contracted through Title V with IHS. So that means that we are able to see everyone regardless of background and an ability to pay. We have 2 clinic locations, one in Pierre and one in Sioux Falls. We can provide primary healthcare services, behavioral health services, and cultural health services. Something very special about Urban Indian Health is that we are grounded in Indigenous values, especially Medakio Yasin, which means we're all related. So anyone and everyone that we serve, we call our relative, and we treat them as so. That's something that we really prioritize as the WOKA project. And WOKA means to help or assist in Dakota and Lakota. And that's ultimately our goal for our outreach team, is to help all of our unhoused relatives, regardless of their background or where they are at on their journey. We focus on the downtown area. Our boundaries are from Minnesota to Cleveland and Russell to 14th Street. We hope to build relationships with all relatives by providing a safe space for them where they don't feel judged. We have found a great partner in the city. Through our contract, we are required to provide at least 40 hours of active street outreach each week. And that can look differently each week, even day to day. We work in teams of 2, and sometimes we're walking, we're driving around to connect with relatives, new people, check in with folks, while other times we're responding to calls. So low risk, non-emergency calls or community calls concerning our relatives downtown. So we provide an alternative to calling the police. And we aim to connect people to existing social services, community services, and we work with other partner organizations to remind them of their appointments, and we transport them when we're able to. Although we want to do everything we can to help individuals, our main goal is to really connect folks in a compassionate way to housing, treatment, and other supportive services. In the winter months, much of our work is less visible to the public, and that's because we're meeting individuals in the shelter or at the library where they spend most of their time. Our conversations are a little bit different each time of year. Along with asking what they need help with, we make sure they have plans to stay warm in our extreme cold winters. Now that we're approaching the warmer months, I mean, it's very warm out, so we're here. People can recognize us by our teal shirts, our urban feathers, I don't know if you can zoom in on this, and our Woke vehicle. We're still asking people what they need help with. Do they have food and water? Do they have a safe place to stay? Are they able to stay warm this summer? And when they're ready to help, we meet them where they're at and help them reach their goals. That can be connecting them to Medicaid, connecting them to healthcare, helping them through the steps to get to treatment for substance use disorder and mental health, and referring them to community social services, including the county, or just assisting them with certain documents that they need for jobs or housing. Sometimes we're able to help right away, and sometimes that takes a lot of trust building and relationships before we can understand what supports they need. One of our biggest successes are building relationships with our relatives, but also with our community partners. In 2024, we helped 226 unduplicated contacts while on outreach. We were really successful in connecting people to substance use treatment, mental health, medical services, and we strengthened our relationship with Sioux Falls PD, the City of Sioux Falls, DTSF, and other outreach teams. We were able to help 11 folks reconnect with their families and return home. In 2025, one of our biggest wins this year is helping our most vulnerable elder on the street access treatment and long-term housing and care. There were so many barriers, denials, and cracks within the system that without our focused advocacy and collaboration with our team, with the city, the Link, the county, Midwest Street Med, the shelters and treatment center, this relative would have been in a much worse position today. This is just one example of how we're able to help and the commitment that it takes to address the multiple complex issues facing our relatives. So our team meets these relatives where they're at, advocates for them, loves them, and helps them meet their goals. We have seen it in success in our work, and we really do have to collaborate to make a difference, whether it's with Michelle, the county, our police department, or other service providers, and we understand that we all play an important role. And the more we work together, the more impact we will be able to make. And if you want to support our work, you can donate to South Dakota Urban Indian Health. Thank you for your time, and I'll invite Michelle back to the podium to close us out.
So as mentioned earlier, making a difference in helping these individuals is very much a collaborative approach. We're glad to highlight the work of Urban Indian Health, but we can't only count on them to continue to move the needle forward. Everyone plays a role in this as a community, and we just really look forward to working together as we move forward. So with that, I'll take any questions at this time.
Michelle, can you talk a little bit about this? This started as like a pilot project with the city. Can you talk about what metrics you guys were looking at in renewing that contract, and if that contract has the same that partnership is structured in the same way this year as it was last year?
Yeah, so one of the biggest metrics that we looked at that was established very early on with the inception of the contract was that 40 hours street outreach. We just wanted to make sure that this team was visible, that people could see them, they could know that they're a resource to them, not only our businesses, but just people in the community that might need them or want to ask them how to help. The other metrics within this contract, the majority of them have stayed pretty stable. We've adjusted a few here and there, mainly because once these guys got into the work, it kind of grew a little bit. They realized that there were a few additional things that they were doing on a continual basis that they were good things for us to continue to look at. And it was important for them to be able to kind of take credit for that work too within this contract, because it was just kind of a little missing piece that maybe hadn't been identified when we started the work. So for the most part, it's the same with just a few little additions here and there.
When we talk about the topic of those experiencing homelessness, a big message is that it takes everyone. It's a very community-driven thing. Is there any message you'd like to share with the community going into those summer months of what people can do to help this thing that you're addressing today?
Well, I think, alongside South Dakota Urban Indian Health, we also have our downtown Sioux Falls ambassadors. These guys work super closely together, especially in this downtown area. As we're out and about and we're talking to businesses, some people don't know that that's a resource to them to just be able to avoid having to make a 911 call, calling our police department and activating those emergency services when maybe it's not an emergency. That's what these guys are here for. So we just very much encourage people to use them. That's what they're here for. And they very much want for you to give them a call so that they can get in and have those conversations first. I also think that our nonprofits are spread thin. There's a lot going on. And so right now we have our Cash Handouts Don't Help campaign right now going on. And so we just really encourage for people to not give out cash, especially when it's this warm. We've just saw a lot of really significant safety concerns last year with the heat and things like that. So, but maybe to redirect and look at some of these organizations that are also out on the streets providing those services to those individuals. We've experienced a lot of funding cuts, and they're still out doing their thing every single day. So look at maybe finding different creative ways to volunteer or to give in our community outside of that.
And then the other one too, just asking if there's any other new initiatives. I know you mentioned the campaign, seeing those signs. I know social media ads are kind of being rolled out on that. But there are any other unique initiatives or anything new this year that you guys are doing?
Not necessarily new, but you will see once school gets out, our police department has a special team of individuals that are downtown, out walking around, helping. You will see those guys out and about again. We also have our collaboration with Southeastern, that mobile crisis unit. We're all working super collaboratively together. I think that other organizations have looked at what could outreach look like for us too. We also want to be a part of this solution. And so, you heard Monica talk about seeing Midwest Street Med. They are out and about walking around. Sometimes you'll see our county folks out walking and having conversations with people. And we also have a representative from our VA that's out doing the same thing. So you might just see, different folks having conversations and interacting just to try to find out what the next steps are and how they can help.
I wonder if you might address the perception versus the reality with homelessness, in that you brought up the Cash Handouts Don't Help campaign. That's targeted at a fairly specific individual group of individuals, but that's not necessarily homelessness. That's what people think of.
Correct.
That's the visual thing that they see as homelessness, even though those folks aren't necessarily homeless. And I'm wondering the degree to which the street outreach is reaching out to those folks but there really is a whole nother aspect to that that is beyond downtown, first of all, but also just an unseen element. And where is the homeless population? It's not those people, correct?
Yeah, you're right. We at the city here received multiple reports from businesses that aren't downtown of individuals that were asking for cash, but then they followed them into a really nice pickup truck right around the side of the building. And so we know that is not always the case. We know that what we're seeing downtown, these guys, their focus is not whether or not someone's panhandling. Their focus is to have those conversations with individuals and really try to begin that conversation of what next steps look like for them. Sometimes it doesn't mean that they want to make that step right now or today or tomorrow, but they're creating those relationships so that the next time maybe they do see them out and about or standing on a corner or struggling, they know who they are. They can have those conversations. As far as our street teams and having interactions with people that maybe aren't unhoused, I guess I don't necessarily have any other stories or relatable things to that question outside of just what the businesses, when they call and they tell us what they've seen or concerns. And sometimes that's scary to them too. They don't know who those individuals are. They may have been approached at Walmart or, something like that. So I think for us and for this team, really the focus is just to make sure that people have what they need, especially in these warmer months.
So typically, and this is probably for urban and Indian health, where do these interactions happen with your street teams? How do they happen?
So we're really focused between Minnesota and Cleveland and Russell and 14th Street. So we're really focused on the downtown area. We like to go where they are. So like if that's at the shelters, at the library, we just know where we can find folks, and that's kind of where we go. We go meet them where they're at.
Is urban camping becoming more of a problem as we enter the warmer months? How much of that is, along the river, under the bridges, that kind of thing?
Yeah, you do notice people outside more often when it gets warmer, and that's just their preference. But we do try to remind them of the safety of that there are shelters available, and to, mind the weather and be safe, and yeah.
What our total city investment is? I mean, we have this, as you said, we have one contract with Urban Indian Health. There's the downtown ambassadors. What's our
Yeah, that's a great question. And we've talked about this here recently, but to pin that down to an actual number when we're looking at what our planning and development department puts in for affordable housing, all of our subsidy service contracts and things like that with the nonprofits, it's really hard to nail down an actual number, but it's quite a bit. I mean, we're supporting quite a few nonprofits along with some of those root cause organizations that are helping try to provide therapy and treatment. And, you've got the Link and Shelter for Family Safe. I mean, it's a large chunk of change that the city is investing into this. It's really hard to put a number to.
These two contracts are really a fraction of the overall investment, though.
Correct. Yeah, a very small fraction.
You guys talked about, part of the goal of this being limiting calls to police and instead of calling police, reaching out. Let's say I'm walking around downtown and see someone who maybe appears to be struggling or in a situation where, I'm concerned for their safety, whatever it might be. What should I do just as kind of average Joe citizen walking around? Are there numbers besides the non-emergency police number to call? Are there, I'm curious what you'd like folks to do.
You want to answer that?
Yes, you can feel free to call us. I have the number if you're ready. 605-809-5636. And I know DTSF has a little thing on their webpage on who to call. and that has their number as well, and our number, and the non-emergency and police. And we're not trying to take any situation from the police. Like, we assess every situation and see if that we can help. So the non-risk, non-emergent calls.
All right. Thank you guys for coming.
Thank you.